Elizabeth House is a 12-bed inpatient unit that Four Seasons has for bringing in folks that have symptoms that need to be controlled, whether that's early in the disease process or later in the disease process. Lots of people when they hear Elizabeth House, they think that's just a place that people go to die. We hear that all the time, so people are hesitant to come in. But we actually have a large number of folks that come in because they have pain that can't be controlled. They come in, we get it controlled, we send them back home.
Whether they're dealing with some acute symptom management needs that our docs are really great at tuning into and helping them address, or if they just need their medication regimen tweaked, we have a lot of folks who'll come in and it'll be a shorter stay. We'll get their symptoms better managed and then they'll be able to go back home.
What symptom control or general inpatient level of care allows is the family can just be family for a while. Often the family have been not just the caregivers, but almost the medical people at home. They're having to dispense medicine, keep up with medicine. So when we need to bump that up, it's wonderful to have a place for patients to come so that medical professionals can do the medical professional thing and the family can go back to being just the family.
Elizabeth House is such a notch above, and when we've admitted people from the hospital, patients and families alike, one of the first things they always comment on is the environment and how calm it is and how relaxing it is and peaceful and soothing.
Well, I think one of the ways that hospice care in general and Elizabeth House care in specific is unique is that it truly is patient-centered care. And by that, we mean patient and family-centered care. So we really do put the patient and the family at the center of care. And everything we do is to enhance what they want, how they want their symptoms controlled later, how they want the end of their life to go. We are all about serving that. Let's say somebody comes in with increased pain. They want their pain relieved, but they also want to be as awake as they can. So we are going to carefully, over hours and days, titrate the medicine so they get what they want, so they can be as awake as possible in the face of aggressive pain control. Respite care specifically is a Medicare benefit where folks are offered 5 days of stay in the Elizabeth House just to give the families a break. It's set up well in advance usually, and they come in, we take care of them, and they go home. You don't have to have symptoms to qualify for respite. You just need to have a family that needs a break.
A respite level of care at Elizabeth House is folks who are coming in from home, and we're going to follow the plan of care that they've been following at home. So there are no changes to meds. It's a safe clinical environment where the patient will stay while the family does whatever they need to do during that period of respite. The whole team shows up every day and is ready and willing and eager to do whatever they can to make a difference for our patients and families.
One of the things that keeps me going and wakes me up in the morning is it really feels like a privilege to do this work. And I think everybody at Elizabeth House and really through Four Seasons Hospice has a sense of that we get to accompany people and help them and serve them at a time that's really meaningful to them. And it really is quite meaningful to be able to do that as a professional.